Okay, all right. So, hello, dears. Ayan. So, welcome again to another pre-recorded lecture in your clinical bacteriology class. And actually, hapit na kita mahuman, gagmay na lang yun kayo ng mga lectures, no? Hapit na yun mahuman ang semester, hapit na mahuman yung klase sa Bacte, inyong bestie so far. All right, so for this lecture, we're now again going to continue with specimen processing and handling, and yeah, different specimens for culture. Okay, and this part, what we're going to discuss is the urine culture. Now, urine culture is a quantitative culture. Okay, so when you say quantitative, you need to count. Okay, and natin mga solving gamay. All right, so why do we need to quantitate urine? All right, okay, you may be asking, sir, anong ubang dili? Anong nga ubang dili specimens sila to quantitate? Because again, our number of counts, okay, or the number of colonies natong makuha or kato mga solving, all right, that will guide us, all right, in the diagnosis, all right, or in the confirmation if ang infection ba na nag-cause or ang infection na experience sa patient, is it significant? All right? Is it really UTI or is it because contaminant lang siya or is it, wala lang jud. So, in a way, the quantitation atong ginabuhat diri will serve again as our guide to establish if the infection is really UTI of bacterial origin or wala lang, contaminant ra ba itong na-isolate na to or dili siya significant, okay? And besides, aside from that is, because again, males and young kids ba to, they rarely get UTI, alright? So, that is why we need to establish counts or that's why we need to quantitate them, alright? Para makabaluta if kano sa siya significant at what number of the bacteria na ito na-isolate significant siya. Okay, that's the importance of quantitating. Alright, so so far sa atong specimens na itong i-discuss, ang urine ato dyong i-quantitate. Siya ragyo i-quantitate. But the rest of the specimens, wala kaayoy quantitation. Alright? Okay, so again, that's your urine culture. Okay, so we'll start first with some introduction to your UTI or urinary tract infections. Your UTI are among the most reported bacterial infection in patients because, again, it's one of the most common. I think at some point in our lives, naka-experience na tag-UTI. Maybe katong bata pa ta or katong elementary pa ta or whatever. So, again, it's really fairly common. All right? Females have higher incidences of UTI compared to males. Again, why? Because, again, I don't know if you can remember in your biology class, basic biology, and also your anatomy. The females, your females, mga girls dyan, mga cis, yes, are CZ-mays, okay, ato mga beshies na girls, they have shorter urethra than men, okay. Because again, nalimot ko pila ka cm, I think mga 2 cm ra ba to, ang urethra sa females. I'm not sure nalimot ko. But the urethras of females are much shorter than men, okay. That's why medyo dali ra gyud makakause og infection ang makakause og UTI or magka-UTI ang females because again mubuo ra ilahang urethra. All right? So if your urethra also of the females are close also or is close to the anus, which is your anus is again teeming with normal flora, usually of the Enterobacteriaceae. So if naay mga improper hygiene practices sa ato mga females, pwedeng maabot ang imuhang normal flora na kagaw from the anus to the urethra, which now causes your bacterial infections or UTI. Okay? So again, your males have much longer, urethras. Depende na if ducts ba siya or jutes. Okay. Alright, so muna siya. That's why fairly good, mas taas good ang urethra sa males. Hence, mas lesser ang incidence of UTI sa males. Okay? Alright, ayan. That's the reason. And again, wag na maisa, who is the most common or what agent or bacterial agent is the most common cause of UTI? Wag na mag-isa. Press the buzzer na yan, it's E. coli. Alright? But there are other species yun. Daghan kayong species of other bacteria na makakause og infection or UTI. But the most common, if ang question ni Ani, most common cause of UTI, nako, wag na mag-isa. Press the buzzer, it's E. coli. Okay. Escherichia coli. Alright. Ascending route of infection, when we say ascending, it's from the urethra padulong sa imuhang, urethra pasulod. So urethra adto sa bladder and then maabot sa kidneys. All right? That's why we have pyelonephritis. All right? We'll discuss that later. And it's the most generally observed route. Okay? But there are some other routes of infection. Pwede siyang hematogenous. So through your blood vessels and lymphatic system, through the lymph system. So if imong UTI dili siya maagapan, okay, then it can spread to the rest of your body. So, pwede na kang mag-disseminated infection. So, it's as much as possible, you have to address your UTI. Okay, yun na siya i-take for granted. Okay, all right. And recurrent infections, again, because of drug-resistant bacteria, they're also increasingly common nowadays, yeah, because again of resistance. And it's vital, again, to properly identify, as with the rest of the specimens natong i-process, it's really vital to identify the pathogens and, of course, the different antibiotics na pwedeng makapatay niya. Okay, ultimately, that's our goal. We want to identify the pathogen, the impending cause of the disease, and then ultimately find a treatment to this pathogen. Because we want to make sure na itong patient will live pa. Dili na itong patcho na itong pasyente. No? We want to make sure na natay antibiotics na ma-test against the pathogen that causes the disease kay para again matambalan ang patient. Okay? All right. And so muna siya no mga medtechs man ta diri no, mga medical students ta diri. Now, you know, as in it's common gyud kayo na akong madunggan sa akong family, sa akong parents na muna sikag inom og coke, sikag kaon og chichirya mo nang magka-UTI ka. Please guys no, as far as I know good, UTI is not caused by that. It's caused by bacterial infection and kinsa ganin na E. coli. So karon, kung na kayo mga kapamilyahan dira, very common yun na sa atong mga boomers. Sa atong mga boomers dyan, mudyo na ilang ingon na kanang pag-ingon og coke, pag-ingon og pagkaon og mga junk food, yeah. Although naay part siguro na makakause siya, but mainly gyud ang cause gyud ana it's bacterial, okay? E. coli. Siguro kana pag-inom natin mga coke, pagkaon ng mga junk foods, it will contribute to formation of mga kidney stones and other renal disease, but not necessarily UTI, okay, na bacterial, okay? Because again, UTI is generally caused by bacteria. And kinsa ang pinaka-common, ana? E. coli. Okay, so, okay ha, educate your kapamilyahan dyan. Alright, okay. Ayan, so that's for the introduction for the UTI. Now, we now go to some urinary tract diseases or terms. Okay, now your UTI can be divided into two major categories. It could be upper, all right, or lower UTI. Okay. So we'll start first with the lower, just your urethritis. Sa name na itself, urethritis, so inflammation of the urethra. All right. Cystitis, when you say cystitis, it's inflammation of the bladder. Or generally, ang cystitis, gina-refer na to as lower UTI. So kanang lower UTI, so ureter down. Okay? All right. And again, this is what you call the lower UTI, lower urinary tract infection. Now, you have urethritis, so by the name itself, ureter ang na-inflammation. Pyelonephritis, na nagit sa kidneys mismo, na nasa sulod sa kidneys ang problem. Okay, so that's pyelonephritis. And kanis lang duha are the upper UTI. So, nagets ra, so ang lower UTI good is from bladder down, bladder to urethra. And then ang upper UTI is from the ureter up, so ureter to kidneys. Alright? Okay, so these are the different diseases. Okay, so and prostatitis as seen in males. Okay, so inflammation of the prostate gland, and cervicitis for females, inflammation of the cervix. Okay, so inanara siya, so mga terms. All right. Okay, yeah, and you have some acute urethral syndrome, bacteriuria. Okay, so we'll discuss or we'll define that here. Okay, so upper UTI again, renal parenchyma, so meaning sa kidneys mismo or sa ureters. Okay. So again, ang upper UTI, ang iyahang different parang divisions are your, of course, pyelonephritis, infection in the kidney. So naay bacteria na naabot sa kidney, all right, and nakakause ng infection. Okay, that's renal parenchyma. And for urethritis, again, inflammation of the ureter, infection in the ureters. Now for lower UTI, again, it's from the urethra down, so urethra up, bladder down na lang. So urinary bladder, urethra, prostate sa males, and cervix also sa females. All right. So cystitis is again inflammation of the bladder. So it is presenting as dysuria or painful urination. Palaging siging pangihi o siging ganahan mangihi. All right. So urinary frequency and urgency. Urethritis, ay wrong spelling. All right. So inflammation of the urethra, and prostatitis, inflammation of the prostate, and cervicitis is inflammation of the cervix. Now, recall in your AUBF, nako, sana naman ma-remember. Diba, you have pyelonephritis, okay, and cystitis. Now, both of them are caused by bacterial infection. Now, in your AUBF, microscopic exam of urine, unsa tong urine sediment na maka-differentiate sa duha? Okay, may tagma-answer dayon. Alright, it's your WBC cast, diba? Okay. Kaya asa man makita na ang WBC cast? Sa pyelo or sa cystitis? Sa Sa pyelonephritis, okay? Sa cystitis, wala. Because recall, WBC cast, okay? Your casts are formed only within the kidneys or inside the kidneys. Now, your cystitis is inflammation of the bladder. So, you don't see casts being formed in the bladder. Okay? So, therefore, if a patient has pyelonephritis, okay, naagyo na siya WBC cast. Why? Because your kidneys are infected by bacteria. So, therefore, WBCs will go there. Alright? And because of too much WBCs, alright, and medyo inflamed imong kidneys or na ay problema sa imong kidneys, now, WBC cast is formed. Okay? But sa cystitis, diliin mo na siya makitaan. Kay lower naman, okay? And di ba, casts are not formed in the bladder. Okay? But the rest, bacteria, WBCs ra, of course, both of them, they have it. Okay? So, asa na ang defining na maka-differentiate sa duha, pyelo and cystitis? WBC cast. Nako, please take note. Lumalabas sa boards and sige nang balik-balik. Hopefully na-mention sa inyo CM. Okay? Alright. And we also have what we call, di ba, acute urethral syndrome, na-mention ganina. For acute urethral syndrome, it's just, it's a disease na naay dysuria and pyuria. So, therefore, dysuria and dysuria, so kato painful urination, and pyuria. So, naay painful urination, and increased WBCs in urine. Alright? And for bacteruria, mabulol man ta, oy. Bacteruria, of course, increased bacteria in urine. Okay? And some patients may feel it symptomatic or some of them kay dili. So patients may be symptomatic or asymptomatic sa bacteruria. Alright? So the presence of detectable bacteria or increased bacteria in your urine. Alright, okay. So those are some terms, diseases na makakause sa sa urinary tract. Now we go to some normal flora, okay, of your urethra because it's important to determine what are the normal flora para dili siya ma-misdiagnose. So as you can see, daghan kay normal flora sa inyong urethra. So you have cons, of course, coagulase neg, except lang for Staph saprophyticus because Staph saprophyticus is a pathogen yun. Alright, diba? Common among sexually active young females. Naku, yung mga ano dyan, alam na. Maraming bookings. Joke lang. Alright. Now, you have viridans and non-hemolytic strep. Naku, yung mga strep sa inyong urethra. Lactobacilli, of course, sabuta sa females, right? Lactobacillus acidophilus, which maintains the acidic environment of your vagina. Kailangan nyo yan. Alright? Kaya maasim-asim. Joke. Alright. Diphtheroids, Corynebacterium, non-pathogenic, Neisseria. That's why, di ba, in urethral swab, na-mention ako, na for females, we don't rely only on gram stain of the urethral discharge. Because again, there are a lot of non-pathogenic Neisseria sa ilahang sa vagina. Alright? So, dili diagnostic tong urethral discharge because there's a lot of Neisseria there. Pero for males, na wala kay Neisseria, alright, sa ilahang normal flora sa ilahang urethra, so ano na siya, diagnostic na ang gram stain na naay intracellular gram-neg diplococci. Okay? Please take note. Ayan. Alright. Aerobic cocci, propionibacterium, anaerobic gram-neg, commensal, mycobacterium, and mycoplasma. So as you can see, ubay-ubay ang naa sa inyong urethra. Alright? Okay. And all areas of the urinary tract above the urethra are considered sterile. So bladder, your ureter, and of course kidneys. So your urethra is really teeming. Daghan kay siyang normal flora, as you can see. But starting sa bladder until sa imuhang kidneys, it's considered sterile. Therefore, kung na kayo makitaan yun na bacteria, gikan ana na specimen, gikan ba sa bladder, sa ureter, or sa kidneys, it's really considered significant. Because again, those areas in normal circumstances or under normal circumstances, they are considered to be sterile. Okay? Alright. Ayan. So we now go to specimen collection. Alright. So, of course, for urine, dapat sterile ang containers. Di ba for stool, pwede dili sterile. Because again, your stool, considered naman siya dagan kay normal flora. Whereas for your urine, samot na if gikan, we're expecting na naay ka ng UTI. As much as possible, we have to maintain it in a sterile environment. So sterile atong container. We collect also the urine sample. Now for transport and storage, okay, so for cleanly voided sample, transport is dapat within 24 hours at 4 degrees Celsius, okay? And storage is 24 hours if na-store siya at ref, okay, ref temperature. Catheterized within 2 hours, 4 degrees Celsius. And if na-store siya at 4 degrees Celsius, pwede siyang ma-store within 24 hours. And suprapubic, dapat immediately at room temp. And storage is, dapat din nato siya store plated as soon as possible. Why? Because recall that suprapubic aspirate, gikan na gid siya sa bladder. So it's really, really sterile. Okay? So we have to make sure na ma-transport nato immediately sa lab. Okay? Para makuha nato or ma-isolate nato tong kagaw na naa dito if naa. Alright? And we don't want to store it kay ma-deteriorate ato ang specimen or mawala atong kagaw na kailangan nato ma-isolate. Recall because again, suprapubic is really sterile. So we want to make sure na ma-isolate jud nato dayon as soon as possible tung kagaw na naa dito if naa manggani. Alright? So I do hope na gets lang. Alright, okay. Now we go now to some specimen types. Now we have the urine culture and sensi tubes, right? Sa inyong CM na po ni, light gray. So it's for specimen transport na ay preservatives. Used if ang transport time would be greater than 2 hours at room temperature. So example, preservatives na you have boric acid, sodium borate, and sodium phorate. So mga bor and phor, mga bor, mga bor. So boric acid, sodium borate, and sodium formate. So these are the preservatives found in your CS tubes. Now, kanisha guys, example, nadiri ang urine, no? So, na siya kanang, I think muna siya ang musuction ba to? Sa ihi. And then, iyara nang ipanslap diri sa tube. And then, masulod ang ihi sa tube. Alright? So, mura siya ETS style in a way. Alright? So, mura muna siya musuction sa ihi, kaning murag tube diri. And then, yan ang ipansak. Imong ipansak sa tube para ma-dispense ang ihi sulod sa tube. Alright? So, inana na siya for urine CS tubes. Alright. Now, for the different specimens of urine. So, first is, of course, the midstream clean catch or clean catch midstream. It's the most common and least invasive. And it's otherwise known as cleanly voided. So only the middle portion of the ihi is collected. So this is in general, Jude, kanang routine lab. Usually nanira to ang pag-collect ng ihi, right? Because again, in a way, it minimizes contamination from the urethra. Because again, middle raman. So ang principle ana is ang first na aga sa ihi, alright, di na to i-collect. Kaya in a way, that will serve as parang siya ang mo-flush. Siya ang mo-flush away sa mga bacteria or epithelial cells ba na naa sa imuhang urethra daan. That's why we collect the middle portion lang. Alright? Okay, so in a way, kailangan na po siya patient education and as much as possible po atong i-clean. Alright? Ato ang urethral area. So ang atong may utog notch. Ato ang penis and ang vagina. So we have to like make sabon there, alright, in a way, before nato siya i-collect. Para, again, still the same reason, minimize external contamination. Alright? Okay. Notch. Okay, alright. Ayan. Now, for the procedure, again, so, of course, label daan with the name of the patient, other pertinent information. For males, again, retract the foreskin if uncircumcised. Okay, so if ano ka pa dyan, yes. And for females, spread the skin. Again, so this is just a procedure, no, na Japanese yung CM. Alright, so basically, ang point lang yun is we have to make sure na atong ilimpyo sa daan ang inyuhang urethra or ang opening sa urethra. And then, ihi na. Again, the first stream of urine dili kuhaon na ang middle portion. Okay? Alright. Ayan. Okay, so processing time, dapat if preservative, greater than 24 hours at room temp. So, katong na-mention ganina. And if without preservative, dapat within 2 hours, ma-process na siya. And within 24 hours if na-ref mangganit siya. Okay, alright. That's for clean catch midstream urine. Next is we have the straight catheter. Okay. So ang straight catheter is, slightly more invasive, pero wala contamination by the urethral flora because diretso man siya sa bladder. Okay, so i-insert ang catheter diretso sa imuha, ang imuhang bladder. So the risk lang of introducing bacteria to the bladder kay kabantay mo, of course, ang catheter kani isulod siya sa urethra. So maagi siya urethra. So pag agi niya sa urethra, pwede siya makadalag bacteria. Alright? Nya pag pansak sa bladder, pwedeng madala niya itong bacteria dito sa bladder. Okay, so mura na siya i-risk niya. Alright, but again, in a way, diretso siya from the bladder. So mas, in a way, mas less ang contamination from urethra na normal flora. Okay, alright, so yan. So bladder opening dire and then ang drainage port. So kaniyang isulod, alright, padulong sa bladder, and then drainage port dire mo gawas ang ihi. Alright, that's straight catheter. Now, for indwelling catheter or your Foley catheter, I think ano siya, kanang muna siya ang bag, alright? So indwelling siya, meaning muna ang isulod, alright? And then diri ang ihi, alright? Diri ang ihi makolect, okay? So balloon port and a drainage port and diri ang collection bag. So diri ang ihi. So mura siya dili siya straight catheter because again, ang straight catheter diretso ang ihi man, mamugawas, di ba? Na ay katong very simple rayahang kanang sana structure na ay katong sulod sa bladder and then drainage port. So diretso ra ang ihi gawas, alright? Pero for indwelling catheter na ay collection bag, alright? Na pa siya mga different drainage port, mga balloon port. Because again, I think this indwelling catheter, pwede siya magamit for other tests, not only for culture or for other tests pag yun sa urine. Alright? That's why we have a collection bag. Okay? So, ayan, so it's for hospitals and nursing homes. It's scrupulous, dapat na-adjure thorough aseptic technique. The catheter port or wall dapat clean vigorously with 70% alcohol. And if mukha kag ihi kay, mugamit kag syringe. And the closed drainage system must be maintained. And for collecting freshly voided specimens, the tubing below the port is clamped off. So it's quite a very complicated no. So wala kay ko sa procedure anim basta sa atong mga nursing friends, mga nursing ex ni John, joke lang. Mga nursing friends na to, alam na alam ito. So basically ang point lang yun is as kabantay mo, it's really sterile, it's really closed system, so really minimizing or avoiding external contamination. So if mo collect kag ihi daw, kuhaon nimo siya diri sa drainage port bato using a syringe, all right? So para and as much as possible dapat na aseptic technique yun sa pag-collect. All right. Tama ba? Alright, catheter port. Catheter port, asa man nadapit? I think tira sa drainage port. Yeah, I'm not quite familiar with. Yeah, pero yeah, inana. So, kabate mo sa picture, kuhaon siya diri sa port, sa catheter port, using a syringe. Okay? And following aseptic procedure. Okay. Alright. Ayan. And of course, the suprapubic aspiration considered to be the most sterile because again, diretso na siya from the bladder. Okay? So, mugamit kang syringe, aspirate from the bladder diretso. Okay? Alright. Percutaneously inserted ang needle. Alright? The bladder should be full, of course naman. So, dapat na siya ihi. Kay walay pulos if mo inaani atong procedure na invasive pag yun niya pag-aspirate sa needle or sa syringe, walay makuha ng ihi. No? So, dapat it should be full. Sample collection dapat, again, skin preparation pa rin para minimizing external contamination from skin flora. Suprapubic urine is again for anaerobic and sensitivity. It's the ideal. Because again, anaerobic, because again, it's a deep tissue. So it's not near the surface na daghang oxygen. So that's why anaerobic culture, pwede siyang igamit for anaerobic culture. Alright, and done for pediatric patients, pregnant women, and other adults with full bladders. Because again, usually kani sila tong, for babies, dili mo ingon kung kano sa mangihi. For pregnant women, kay dili na mabantayan if nakaihi na ba, or like, very stressful ilang environment inana. So again, considered to be the most sterile and applicable siya for anaerobic culture. Okay. Now for microbial detection, we have their screening procedures. Of course, gram stain, if greater than equal to 1 organism in uncentrifuged urine corresponds to greater than equal to 10 to the 5th CFU per ml. So because again, only 1 organism ay mo nakitan. So wala na kailain. So it means wala contaminant. Shara joy naa, so therefore it's really significant. Okay? Alright. Next, you have also pyuria, greater than equal to 8 to 10 leukocytes in uncentrifuged urine indicates significant pyuria. So, presence of PMNs in urine. So, usually sa itong microscopic exam sa urine, alright, sa itong EUBF, alright, so if makita nato na siya, then could be significant. And aside from that, in your chemical methods, of course, sa reagent strip, kinsa to rapid screening test for UTI is of course your nitrite pad, detects your bacteria na capable of nitrate producing, no? Na enzyme, nitrosol reductase, and of course, together with the LE pad, leukocyte esterase. Okay, because it detects the enzyme found in leukocytes. All right. Okay. So for the next video, we'll now go to how do we culture urine, okay? And mga katuna mga different interpretation and different calculations, okay? All right.